Thank you for joining me for this session about new employee benefits for grad assistants and short-term academic staff. While this session addresses 2023 employee benefits, I am recording it in late 2022, and so if I refer in error to the year 2022 aloud, I apologize. Please refer to the slides themselves for accurate 2023 information. This video is prepared for grad assistants, scholars, fellows, and employees in training who are eligible for benefits, as well as short-term faculty, academic staff, and limited appointees who are eligible for this benefits program instead of the Wisconsin retirement system. And this session will provide you with an introduction to the UW-Madison's benefits offered to these short-term employees. It will include how to enroll, what the different premiums will cost you if you were to enroll in insurance, and we'll discuss how the health insurance programs work. If you would like a copy of the slides I'm using to present today, please email us at benefits@ohr.wisc.edu. If you are a short-term academic staff, faculty member, or limited appointee, please review your copy of the slides for some additional important information about a potential future benefit under the Wisconsin retirement system. By the end of this presentation, you'll know how to identify your enrollment deadline, you'll know where to review your plan options, and you'll know how to send us your election decisions or your waiver decisions, whether that's electronically or via paper application. The plans we'll discuss today will begin with health insurance. We'll also talk about life insurances, and then we'll talk about our supplemental plans that include dental, vision, flexible spending accounts, and the retirement plans. Written information about all the programs I'll discuss today are found on our website, hr.wisc.edu/benefits/grad, and you're welcome to email my office directly to ask benefits questions, benefits@ohr.wisc.edu. You'll also want to get to know your own department's HR, and if you're uncertain who those HR contacts might be, you can find them at hr.wisc.edu/contact. It will be important for you to get to know who to reach out to at your school, college, or division so that you better understand the organization of your school, the contact lists of important persons, and your own unit-specific policies. You'll also need to know how to contact them via email so you can ask leave and payroll questions. You'll visit my office's website, hr.wisc.edu/benefits/grad, for more written information about the plans for which you're eligible, as well as to view the health benefits decision guide for the year, which gives an overview in writing of the health and dental and vision benefits available to you. You might also sign up to use Benefits Mentor on Employee Trust Fund's website, which will allow you a personalized review of the state health plans and their annual costs. When you reach out to my office, have your employee ID number, or EMPL for short, ready to share with us. You'll find this number on your pay statements, and it's the number we use instead of your Social Security number to file your information in our system electronically. Your EMPL ID number is not the same number that's on your WISC card, so you will need to pull up your pay statement and have that ready, the employee ID number, when you reach out to our office, so we can look you up using it. From the date of your eligible hire, you will have 30 days to consider your different benefit options and enroll or waive in most of the plans. This is literally 30 days from your start date, your eligible hire date. So you can bring out a calendar, note the start date of your appointment, review your appointment letter if you're unsure of what that is, and then count 30 days from that date, and that will inform you as to your deadline, the last day by which we must receive your enrollments or waiver decisions for your new employee benefits. As you consider what plans you want to elect versus waive, you'll want to, of course, consider what you might need for coverage right now and for the rest of this year, as well as the coverage that you might want next year or the year in the future. Some of our plans allow, even if you waive now as a new employee, allow you to enroll at, in the future at any time of year. The accidental death and dismemberment policy, as well as our pre-tax parking, supplemental retirement, and college savings plans offer this option. Other plans, like the health, dental, vision, and accident insurance, and our flexible spending accounts, will offer perhaps a regular opportunity to enroll, even if you waive them now as a new employee. You might be able to enroll during a year if you incur a significant life event, like a marriage or the birth of a child, or you might, during our annual fall enrollment period, sign up for one of those programs, and they would begin the following January. Different life events affect the different insurance plans in different ways. So to learn more, please visit our benefits website and look up the qualifying life events page to learn more. I do have embedded into this slide some additional specific slides about international employees and employees who will be turning 26 and will lose their parents' coverage. Learn more there. And then we come to the type of insurance that could be now or never for you, and that is our life insurance plans. If you do not enroll in the life insurance plans now as a new employee, you may not be able to enroll in them in the future. So please carefully consider your current life insurance needs and also what you think you may need in the future. When you're ready to submit your benefit decisions, you'll do so online. You'll need your UW Net ID and password ready, and then you'll log in to your MyUW portal at my.wisc.edu. You'll go to the Benefit Information tile and click the Enroll Now button that's in the middle of the tile. There are also two other hyperlinks on that Benefit Information tile. One takes you to more information about benefits, and the other is where in your future you'll find the summary of the benefits you've elected and waived. At present, of course, it would show that you've waived everything if you haven't yet enrolled in anything. If you don't see the Benefit Information tab, you can search for it and add it to your UW home screen. If you have the Benefit Information tile, but you don't see the Enroll Now button, that may indicate that you need to complete and hand in paper applications rather than enrolling or waiving online. If you find you're missing the Enroll Now button, ask your department HR contact to see whether your online enrollment button can be fixed or whether you'll need to turn in paper applications. If you must submit paper applications, you'll find all the forms on our website. Each insurance plan has its own application form, so you'll want to look up each for whichever you're enrolling into. If you must submit paper applications and you want to tell us that you're waiving the health insurance, there is a section on the application form that you would mark to indicate that you've decided to waive, otherwise known as decline, the insurance. If you must submit paper applications and you want to waive the other supplemental plans, such as life insurance, dental and vision plans, then simply do not submit enrollment applications for those, and the default is that you will have waived them. If you choose to enroll in the insurance and do so timely, your health, dental, vision, accident insurance, and flexible spending accounts would be effective the first of the month following your date of eligible hire. Or if your date of hire was the first, then the coverage would be retroactive to that very start date itself. If you enroll in the accidental death and dismemberment policy or one of the life insurance plans, your coverage will be effective the first day of the month following 30 days of eligible employment. Once you've submitted your elections or waivers online, you'll receive a confirmation statement a day or two later. Please review that confirmation statement and let us know if anything is amiss. If you had to submit paper applications, you won't immediately see a confirmation statement. It does take us manual work to enter those physical paper applications, and it can take as many as 30 days before the information is entered. As an employee, you'll want to review your earnings statements regularly. You'll find those in the MyUW portal under the Payroll Information tile. Be sure to review your earnings statements for your rate of pay, the number of hours that you've worked and for which you've been paid, and then also the insurance premium deductions that are being withheld. Because for any insurance that you've elected, you will have deductions coming out of your paychecks to pay for that insurance. We at the UW-Madison are paid biweekly every other Thursday, 26 times a year. To review the schedule for upcoming pay dates, visit our website to view the pay calendar for the coming year. You'll want to keep track of which pay period you fall into because most of our insurance premiums are split between the A and the B checks. For example, the January A would have prepaid for the first half of February's coverage, and the January B would have prepaid for the second half of February's coverage. When the Cs come up, there are very few deductions withheld from the Cs, other than taxes and retirement deductions. The insurance premiums for the health and the dental, for example, are not usually withheld from the C paychecks. As a new hire, it can take several paychecks to catch up on the premiums due, since the rest of campus has been prepaying for their premiums from earlier checks. And you're new here, you didn't have an earlier check, so you may have double ups, even triple ups on your initial paychecks received once we have your insurance set up in our system. But eventually, everything will smooth out and you'll begin to see the regular biweekly deductions withheld from your checks. Talk to your department payroll and benefit coordinator if you ever have any questions about your paychecks. And now we can talk about the health insurance. You see here a screenshot from our website, and scrolling down the site, you'll find the list of all the different insurance plans you have available to you. And of course, in the circle here, we're starting with the health insurance for our discussion. How much it will cost you to enroll in the health insurance, and then which doctors you can visit, what services you can incur, and how much you will pay when you receive services, all depends on which of the health plan options you elect. You must choose between two health plan designs. One is a Wisconsin-based plan and is less expensive. There's also a nationwide plan that is more expensive. But the Wisconsin-based plan has smaller choices of doctors. The Access plan has an entire nation of doctors from which to choose. And then whether you choose the Wisconsin-based health plan or the nationwide plan, you can attach a preventive dental insurance to either if you would like to. And this preventive dental is called the Uniform Dental Plan. So for an extra $3 to $9 a month, you can have cleanings, exams, your children could have orthodontic treatments covered in full or in part by the preventive dental insurance. We have more information about the uniform dental insurance that can be attached to your health election on Delta Dental's website, as well as our own website. On this slide, you see the premiums for the coming year's health insurance. There is a health plan column and an access plan column, and each has premium costs for you as an individual only, if you're signing up for single coverage just for yourself, or a row for family premiums, if you have a spouse or children whom you'll be covering under your plan. You'll also see both with and without uniform dental information. If you elect the health plan, you must also choose a network of doctors to be your doctors for the coming year, and you will only visit those doctors unless it's an emergency. Here in Dane County, that usually means that an employee chooses between Dean, GHC of South Central Wisconsin, or the Courts UW network. Each of these offers doctors here in Dane County. If you were to choose the nationwide access plan instead, there are providers here in Dane County, as well as the other counties in Wisconsin and the other states within the nation. If you're interested in the health plan, you can review Employee Trust Fund's decision guide and their health plan search web page to determine, depending upon the area in Wisconsin in which you live or plan to seek services, which of the health networks you may want to elect as yours for the coming year. Again, in Dane County, that usually means Dean, GHC of South Central Wisconsin, or the Courts UW plan, but you may be planning to seek services in another county of Wisconsin, and so you'd want to review that particular county's options and make a choice that's appropriate for you and your family. If you plan to seek medical care just outside of Wisconsin in a surrounding state, there may still be a health plan that offers you in-network doctors, even though you're in Minnesota or Iowa or Illinois or Michigan in the UP. Again, take a look at Employee Trust Fund's health plan search webpage for more detail on which network offers coverage where, so you make the best decision for you for the coming year. And though my office is not able to tell you which network will be best for you, we can offer you these resources. You will want to visit the different websites and consider your network options based on the county that you plan to seek services in. Ask about your current medical provider, if that's valid, to see whether you can stay with your own doctor. You could also review where their clinics are located to ensure you choose a network option that has convenient offices. You might ask about their telemedicine services. And you might also ask about the hospitals where they would send you if you needed surgical procedures. Any of those could assist you in choosing the best network for you for the coming year. And if you enroll in the health plan or the access plan and you're visiting your network providers, your preventive care is covered 100% by the insurance. There are certain items that are considered preventive services and others that are not. So you'll want to review what's considered preventive for you at healthcare.gov. Search for the word preventive, and it will bring up the information about what would be covered 100% for you. And if the care you need is not preventive, then this is where you share part, if not all, of the cost of the services you incur. So to better understand how the health plan and the access plan work, we'll now talk about the copays, deductibles, coinsurance, and out-of-pocket limits of these plans. So to revisit, we have the health plan in blue on the screen, which if you've elected it, you've chosen a small network of doctors to be your doctors for the year, and you visit only those providers. Or you may have elected the more expensive access plan with its option for nationwide in-network providers. And in fact, it even allows you to go outside of the network completely, although it pays less for those services. With both the health plan and the access plan designs, when you visit your network providers, you will pay an office visit copay. It's a copay of $15 if you're visiting a primary care provider. It's a $25 copay if you're visiting a specialist or an urgent care clinic. And it's a $75 copay added on top of your emergency room bill if you need to visit the emergency room and rather than admitting you to the hospital, they fix you and send you on your way. Beyond office visit copays, you also have an annual deductible for which you're responsible each year. The deductible is $250 per person, and this is your share of your first X-ray, diagnostic labs, or surgical expenses each year. For example, if you needed an X-ray on your arm because your doctor was worried it was broken, the X-ray itself may cost $1,000. You would be responsible for $250 of that if you hadn't yet met your deductible for the year. If you do meet your annual deductible, then coinsurance kicks in and you begin to pay just 10% of the remaining X-ray costs, diagnostic labs, and surgical procedures for the year. The insurance company picks up the other 90% for you. When you consider your office visit copays and your coinsurance charges, if you've spent $1,250 on in-network covered medical care for the year, then you've met your out-of-pocket limit. That's $1,250 as the maximum you would pay for medical care for the year. And at that point, the insurance companies would take over the remaining in-network covered costs for you. Pharmacy benefits are slightly separate from your medical care under our insurance plans. So for pharmacy benefits, you need to know the name Navitus. Navitus is the company that runs our prescription programs. And you can search the Navitus formulary, in other words, the list of prescriptions that are covered as well as those that are not covered by our insurance, out on Employee Trust Fund's website. Different prescriptions will be listed as a different level on the formulary. Some will be considered preventive. When you fill those at the pharmacy, you pay nothing for them. But when you're filling level 1s through level 4s, there will be a cost to you when you fill that prescription at the pharmacy. Level 1s, you pay $5 per fill. Level 2s, you pay 20% of the cost of the prescription, although not more than $50. Level 3s, you pay 40% of the cost of the prescription, up to $150, and you also pay the difference in cost between the level 3 and an alternate, less expensive drug if available. And level 4s, the specialty drugs, you pay $50 per fill. Again, learn more about your pharmacy benefits through the Navitus website. If you meet the pharmacy out-of-pocket limit for a drug level, then you pay nothing for the remaining drugs that you fill in that level for the rest of the year. And at your in-network pharmacies, you can receive vaccines showing them your Navitus card, and you'll pay nothing for those vaccines. Here's an overview of the in-network coverage offered through the health plan and the access plan designs. Your prescription costs will have a copay associated with them, and you'll pay that every time you fill your prescription at the pharmacy until potentially you've filled so many drugs in a tier that you meet the out-of-pocket limit for the rest of the year. Your office visit copays will be $15 or $25 each. And if you need medical care that falls under the deductible, you are responsible for the first $250 of your annual deductible, and then the coinsurance kicks in. And if between office visit copays, deductible, and the coinsurance, you end up spending $1,250, then you've met your medical out-of-pocket limit for the year, and the insurance company pays the remaining medical costs until the year resets next January 1st. Under the health plan, if you go out of network, out of the doctor's group that you've chosen for yourself for the year, the only services that could be covered by the insurance plan are emergency care and urgent care. On the screen here, we have some examples of emergency care needs in which you should try to use your in-network emergency room whenever possible, but it's understood that if you're having a heart attack, you need to visit the nearest emergency room in order to be treated. There are also examples of urgent care needs here, and you must use your in-network urgent care clinic if you are in your network service area. If you are out of the area completely, you can work with your insurance company, give them a call, let them know that you have an urgent care need. If you enroll in the Access plan with its nationwide network, the out-of-network coverage is a bit different than the health plan itself. Under the Access plan, if you go out of network, it's allowed, even if it's not an emergency or even if it's not an urgent care need. However, your expenses will be higher than if you'd stayed in your network. You pay the first $500 for covered medical services received out of network, and then the coinsurance is 30% your expense, 70% the insurance company, and you continue to pay your 30% until you've reached a $2,000 out-of-network limit. There are several things to consider before you decide which health plan is best for you for the coming year. We want to use the resources on both the UW-Madison Benefits website as well as Employee Trust Fund's website to consider which of the health networks may be best for you, whether they're Wisconsin-based or you need that nationwide access plan network. And then if you were to choose one of the Wisconsin-based plans, choosing which of the networks within the county that's best for you will still require additional research. You want to review those different network options, contact them if you have questions about where their clinics are located, and then review Employee Trust Fund's frequently asked questions and other resources on their site. And again, your health insurance effective date will be the first of the month following your date of eligible hire, assuming we receive your application for enrollment timely within your 30 days. To submit your benefit decisions online, go to the Benefit Information tile within the MyUW portal and click your Enroll Now button. Your view of the online health enrollment screen may differ slightly from this particular view, but you will see, once you get into the program, a way to select and open the health insurance information, and then a list of the different health plan options available to you, all of them that are available to every employee throughout the nation, and you'll want to look for the name of the coverage that you want to elect. And the default will be set to waive, so you'll want to select off of the waive if you want to actually choose to enroll in one of the different plans. And to find the Wisconsin-based plan that's best for you, again, review your choices and then click Select next to the name of the network that you wish to have for your coverage for the rest of the year. And if you want the preventive dental attached to your enrollment, you will want to look for the name of your doctor network and dental as listed on the line. If you are unable to submit your selections online, you must submit paper applications instead. You'll find the paper application for the health insurance on our website. You'll complete it whether by printing and handwriting or by typing in online and then printing and signing your application and turning it in to your own HR office or to my office directly. We must receive your paperwork by your 30-day deadline. If you enroll in the health insurance, you'll receive 2 or possibly 3 ID cards in the mail. You'll receive a card from your insurance network. You'll also receive a card from Navitus for your pharmacy benefits. And if you selected the and dental option so that you have the preventive uniform dental, you'll also receive a card from Delta Dental. The cards are mailed to your home or mailing address on record, so be sure that your personal information is up to date in the MyUW portal, so they send your information to the correct address. And now we move on to life insurance. There are 2 or possibly 3 life insurance plans available to you. Life insurance could be important to you because in the event that you pass away while covered by the plan, a life insurance policy would pay an amount of money to your chosen beneficiaries. You might consider electing an employee life insurance policy if you have people in your life who rely upon you to pay some or all of their bills, or simply to cover the cost of your funeral if you were to die. If you do enroll in one of the employee life insurance plans, be certain to submit a beneficiary designation form to the insurance company so that they would know who your beneficiaries are, who they would pay the money to if you were to pass away while an employee covered by this plan. There are 2 optional life insurance plans available to you. One is called the Individual and Family Life Plan, and its benefit can be as much as $20,000 as a new hire. You could increase its value upon your life annually until potentially you have as much as $300,000 on your own life. Or there's the UW Employees Inc. life insurance policy, which, if elected, has a certain benefit that would pay out based on your age at the time of your death. What enrollment into the individual and family plan would cost you depends on how much coverage you elect. And the coverage cost for your UW Employees Inc. life insurance depends on your age. Under the individual and family life policy, there is coverage available if you elect it for yourself, for a spouse as well, or for a child. If you elect the UW Employees Inc. plan, it's just for your own life. It doesn't cover any family members. You have your initial 30-day window to elect or choose the default of waiving the individual and family life insurance, and or the UW Employees Inc. life insurance. If you don't enroll now as a new employee within your initial 30 days, then you've by default waived the life insurance. And if you were to apply in the future, late after your 30 days, there is a special application form that you would complete called Evidence of Insurability, where you release certain medical information, and underwriters on the plans review that late special application, and they may or may not approve that Evidence of Insurability application. So a late enrollment is not guaranteed. More information about life insurance is available on our website. If you do enroll timely in the life insurance, your coverage will begin the first of the month following 30 days from your eligible hire. So this is a different start date than your health insurance would begin. Also available to you as an employee is the UW's accidental death and dismemberment policy and the state's accident plan insurance. You'll find more detail about these plans on our website. You're welcome to enroll in either of the plans or just choose neither of them or enroll in both of them if you'd like. The accidental death and dismemberment policy offered by the UW is with a company called Zurich. This particular program has a charge to you based on the amount of benefit you've elected, which could be as little as $25,000 or as much as $500,000. And the coverage cost depends on whether you're covering just yourself or you're also extending your coverage to your family. If you do elect the coverage to extend to your family, then the amount of payment that would be made to you if your family member were to have an accidental death or dismemberment event would be a percentage of the coverage you've elected for your own life. And for the state's accident plan, it's working with a company called Securian. The cost of the Securian accident plan depends on whether you're covering only yourself or you're also extending your coverage to family members. And under the Securian plan, if you have an accident, you need to remember to make a claim, and then the plan pays you cash, which differs in value depending upon the type of accident and injury that you incurred. Next up, we have the dental insurance. We've introduced some basic dental already when we discussed health insurance, when we were discussing the uniform dental benefits or the preventive care. And now we also can talk about the dental insurance as a supplemental standalone policy. The cost of the dental insurance, if elected, depends on which of the plans you've elected and then whom in your family you're covering. So you'll see on this chart here, the plans have different costs depending upon whether it's the preventive standalone plan, whether you want the major dental coverage of the Select or the Select Plus plans, and then again, whether you're covering just yourself or you're including family in the coverage. Under the dental insurance, if you were to elect the uniform dental or preventive dental plans, then you have a certain amount of coverage for cleanings and exams, emergency pain relief, and periodontal maintenance for the year. But under that initial column there, the uniform dental and preventive coverage, you do not have coverage for major dental work like crowns, bridges, implants, or oral surgery. Instead, if you're interested in that major dental work coverage, you could elect to enroll in the Select or the Select Plus plans. And they are different both in cost as well as which dentists you can visit. Under the Select plan, you can see that the in-network providers are limited to the Delta Dental PPO network, while under the Select Plus plan option, you could visit Delta Dental PPO and Delta Dental Premier providers. The deductibles are also different between those two plans, as are their annual benefit maximums. The Select plan will cover, after a $100 deductible, as much as $1,000 per person per year, while the Select Plus plan, after a $25 deductible, will cover a certain percentage of major services up to $2,500 per person per year. Also different between the Select and the Select Plus plan major dental options are that the Select plan offers no coverage for orthodontics, but the Select Plus plan does offer orthodontic coverage, and not just for children, as the Uniform Dental or preventive plans offer, but in fact the Select Plus plan could offer orthodontic coverage for you as an adult. It would pay 50% of an eligible orthodontic bill up to $1,500 per mouth per that mouth's lifetime. And next up, we'll talk about the vision insurance. The vision insurance is offered through Delta Vision, and you'll find its hyperlink on our website in the supplemental insurance section. What you would pay per month for the vision insurance depends on the amount of coverage you've elected. There is just one plan, so there's no choice to make. It's either yes, you want to enroll, or no, you don't, but you can decide who in your family you want to add for the coverage. If you do enroll in the vision insurance, visiting in-network providers means that you have a yearly routine exam copay of $15 per person. You can also purchase a basic pair of glasses for a copay of $25, or you could elect contact lenses. If you were to elect contact lenses instead of prescription spectacles, the contact lenses, you are allowed a $150 allowance per year. If you enroll in the Delta Vision plan, to receive the greatest amount of coverage possible through the insurance plan, visit their in-network iMed Insight Network eye doctors. And now we're moving on to the pre-tax flexible spending accounts. Information on these spending accounts are available on our website. Most UW employees, though not all appointees, are eligible for the pre-tax spending accounts. Grad assistants and certain post-grad trainees will be eligible, but if you hold a non-service appointment, such as a fellow, a scholar, a graduate intern or trainee, and the postdoc fellows, scholars, and trainees, you will not be eligible for this pre-tax benefit. The flexible spending accounts are offered through a company called Optum Financial and Connect Your Care. The idea behind flexible spending accounts is that you're allowed to set money aside from your paychecks without paying taxes on that money, and then you may spend that money on certain eligible expenses, having never paid taxes on those purchases. As an example, on the screen here, you see, assuming a 25% tax rate, someone with no FSA earning $200 and waiting for the money to come to them on their paycheck may have $50 withheld from their check before they actually receive then what is only $150 in their check. And they can then use that $150 to purchase anything. If they had elected the flexible spending account and had sent the $200 they'd earned into the flexible spending account, then no taxes were withheld from that $200. The money wasn't paid to them on their paycheck. Instead, that full $200 was sent to their flexible spending account, and it is now waiting for them to be spent on certain qualified expenses that they incur in 2022. You are supposed to spend all of the money that you send into your flexible spending account by the end of your eligibility period, which for our active employees is December 31st. You will forfeit some, if not all, of your unspent account balance if you have not submitted your claims timely. There is the health or medical FSA that you may elect for as much as $2,750 and then use that money that you've sent from your paychecks into the FSA on qualifying expenses such as bandages, sunscreen, lab work, doctor's office visits, and other first aid needs. And there's the separate dependent daycare expense FSA that you might elect to up to $5,000 of your money going into the account that then can be spent on daycare expenses or before or after school care. Remember that if you do elect a flexible spending account for 2022, You are meant to spend the money that you contribute into the account by the end of the year. If you don't spend the money in your FSA, it is forfeited. If you enroll in the flexible spending accounts for 2022, your effective date for your FSA is the first of the month on or following your date of eligible hire, similar to what the health insurance start date would be. And the deductions, whatever you elected for the year, would be withheld from the remaining eligible paychecks from the year. If you're not here for a full year, that means that your election would be divided over fewer than 24 deductions because there are not a full 24 paychecks left in the year. You can review the 2022 pay calendar to count out how many more eligible paychecks you would receive in 2022 and consider what your election then would be divided by paycheck. If you do elect the health FSA, then your election is pre-funded, meaning if you signed up for $500 to go into the health FSA, $500 is available in the account as soon as the account is effective. And if you incur expenses at the pharmacy or your doctor's office, you could use your debit card to pay for those expenses directly from the account. It's a bit different with the dependent daycare account's balances. No money is in that account and available to you until the money has been withheld from your paychecks pre-tax and sent over to the account. There is no debit card associated with the dependent daycare expenses. You pay for your dependent's daycare expenses up front, and then you request reimbursement from the FSA. Be certain to save all expense documentation so that whether you've used the debit card for a health expense or you're submitting a claim for your dependent daycare expenses, you have proof the expenses were eligible and you can provide that information to Optum Financial when and if they ask for it. As part of signing up for the flexible spending accounts, you'll want to register online as a new user and consider downloading Optum's smartphone app. The deadlines to use a 2022 FSA mean that you must incur your claims on or after your FSA is effective, but not later than December 31st. Or if your employment ends before December 31st, you would have an earlier deadline. Talk to my office or your HR contact if your employment ends before the end of the year. Another pre-tax account are the parking and transit accounts. If you do incur expenses related to your work that involve parking for work or traveling for work, transit costs, you may have a certain amount of money withheld from your paychecks each month sent over to the parking or transit accounts, and then use that money to reimburse yourself or pay for the parking or transit expenses you incur due to your work. However, if you are here at UW-Madison and you have a UW Transportation Services parking permit, it's possible you don't need to elect the parking account. An annual base lot permit, if paid through payroll deduction, is already pre-tax. However, if you pay for flex parking, meaning you just pay for parking only on the days when you use a lot, or you prepay for multi-day parking, and thus use your debit or credit card to have purchased the parking pass, it's possible the parking account could be useful. Again, this is an account that you could elect at any time of year, and then your coverage would be effective going forward after that election. And finally, we come to our retirement plans overview. You'll find the information about our supplemental retirement plans linked on our website. We have the UW's 403B and the state's Wisconsin Deferred Comp Plan, which is a 457B program. All UW employees are eligible to participate in the supplemental retirement plans, but non-service appointees are not eligible, which means if you are a fellow, a scholar, a graduate intern or trainee, or a postdoc fellow, scholar, or trainee, the remaining plans I discuss will not be open to you. But if you're a grad assistant or a certain types of post-grad trainees, please stay tuned and learn more. So there are the two options, the UW's 403B and the state's 457B, and both work in similar manners in that money can be withheld from your checks, whether pre-tax or post-tax. The post-tax is known as a Roth option. And while there's no employer match, nevertheless, your own money, if you're putting it into the investments, would be sent to the investment company. And ideally, if all works well, the $20 you send them to be invested becomes $21, $22, $30, and more, um, so that by the time you need to retire and you need to dip into the accounts and withdraw money from them, the value of your account will hopefully be worth more than the initial $20 you contributed once upon a time. Now, both of the accounts, whether it's the 403B or the 457B, have a maximum that you cannot contribute more than. And for anyone who's not yet 50, that maximum is $20,500. However, you could contribute $20,500 into each of the accounts. So that much into the 403B and another $20,500 into the 457B if you made enough money and chose to do that. Neither of the accounts have a minimum contribution requirement. So if you can give them $20 or more, great. If you can give them less than $20 a paycheck, that's fine. They will take what you can provide to them and invest it. The accounts do charge certain admin fees. And what the 403B will charge you depends on how much money is in your account and which record keeper you've chosen. There are two options. And the state's 457B charges admin fees once your account has more than $5,000 in it. To enroll in the UW's 403B, you can sign up using the Easy Enrollment Plan document and email it to us, or you could set up an account on a provider's website and then submit the salary reduction agreement, again, sending to us via email. If you want to enroll in the state's 457B, you first go to their website and register using a plan code. And the code that's on the screen here is only good through February 2nd. So if you're viewing this video or enrolling at a later date, reach out to our office or review the code that we have available online for the updated version. Or you could call Wisconsin Deferred Compensation directly and give them the plan enrollment code over the phone to open and enroll your account. And then once established, you can make changes by increasing, decreasing, or pausing your elections, either with the 403B or the 457B, whenever you choose to do so. We have more information for you about the retirement programs, and not just the savings plans, but other things to consider as you plan for your future retirement through 3 different retirement information sessions. We offer one called Starting to Save, which is meant for those who are more than 15 years from retirement. We have a program called the Mid-Career Retirement Check-In, which is meant for those who are between 5 and 15 years until retirement. And we have a Ready to Retire session, which is meant for those within 5 years of retirement. And you are welcome to join any or all of these programs in the future. Registration is free. To wrap up this session, I want to thank you for reviewing all of the slides with us today, and a reminder that if you incur a life event in your future, please reach out to my office or to your own HR office and let us know that you've incurred a marriage, adopted or birthed a child, are turning 26 and thus are losing your parents' insurance, etc., so that we can provide you with the appropriate information that will about how that life event will change or possibly affect your insurance options here at the UW. And with that, our session is brought to an end. Thank you for being with me today and reviewing these slides. Reach out to my office if you would like copies of these slides that include additional information, and have a very good day. Welcome to the UW-Madison.